101. What is the best method for cleaning surfaces contaminated with blood and body fluids? A. Use a dry cloth to wipe the surface. B. Use a standard cleaner without disinfectant. C. Clean with soap and water, then disinfect with an EPA-approved disinfectant. D. Use water alone to rinse the surface. Answer: C. Clean with soap and water, then disinfect with an EPA-approved disinfectant. Rationale: blood and body fluids are high risk for transmitting infectious agents, so cleaning first with soap and water to remove debris and then using a disinfectant is the most effective approach. 102. Which type of isolation precaution is necessary for a patient diagnosed with influenza? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Answer: B. Droplet precautions. Rationale: influenza is spread through respiratory droplets, so droplet precautions, including wearing a mask and maintaining distance, are required to prevent transmission. 103. What is the primary purpose of a disinfectant in infection control? A. To kill all pathogens, including spores. B. To reduce the number of pathogens to a safe level. C. To remove dirt and grime from surfaces. D. To sterilize medical equipment. Answer: B. To reduce the number of pathogens to a safe level. Rationale: disinfectants are used to reduce the number of harmful pathogens on surfaces, but are not capable of eliminating all pathogens, especially spores. Sterilization is required for complete eradication. 104. When should a healthcare worker change their gloves? A. After touching any non-contaminated surfaces. B. After performing a procedure on a patient and before touching another patient. C. Every 30 minutes of continuous patient care. D. Only when gloves become visibly torn or soiled. Answer: B. After performing a procedure on a patient and before touching another patient. Rationale: gloves should be changed between patient contacts or after procedures to prevent cross-contamination, even if they are not visibly soiled. 105. Which of the following is an appropriate action for preventing the spread of Clostridium difficile, C. diff, in a healthcare setting? A. Use alcohol-based hand sanitizers after patient contact. B. Wash hands with soap and water after patient contact. C. Limit the use of antibiotics. D. Perform routine cleaning with a general-purpose disinfectant. Answer: B. Wash hands with soap and water after patient contact. Rationale: alcohol-based hand sanitizers are ineffective against C. diff spores, so hand-washing with soap and water is essential after patient contact. 106. What is the most effective way to control the transmission of healthcare-associated infections, HAIs? A. Frequent use of antibiotics. B. Regular hand hygiene and appropriate use of PPE. C. Minimizing patient contact with visitors. D. Isolating all patients with infections. Answer: B. Regular hand hygiene and appropriate use of PPE. Rationale: the most effective strategy to control HAIs is implementing proper hand hygiene and using PPE to prevent the spread of pathogens. 107. Which of the following is an example of an airborne infection? A. Tuberculosis. B. Chickenpox. C. Influenza. D. Norovirus. Answer: A. Tuberculosis. Rationale: tuberculosis is an airborne infection transmitted through inhaled droplets. Chickenpox, influenza, and norovirus are primarily spread via droplets or direct contact. 108. What is the correct way to dispose of a contaminated needle after use in a healthcare setting? A. Throw it in the regular trash. B. Place it in a sharps container. C. Reuse the needle after cleaning it. D. Wash it before discarding. Answer: B. Place it in a sharps container. Rationale: contaminated needles must be immediately disposed of in a designated sharps container to prevent needle stick injuries and contamination. 109. Which type of isolation precaution is necessary for a patient diagnosed with measles? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Answer: C. Airborne precautions. Rationale: measles is transmitted via airborne droplets, so airborne precautions, including a N95 respirator, are necessary for patient care. 110. What is the correct procedure for removing personal protective equipment, PPE, after caring for a patient in isolation? A. Remove gloves first, then gown, followed by mask and goggles. B. Remove gloves first, then mask, followed by gown and goggles. C. Remove gown first, then gloves, followed by mask and goggles. D. Remove mask first, then gown, followed by gloves and goggles. Answer: A. Remove gloves first, then gown, followed by mask and goggles. Rationale: the correct sequence for removing PPE is gloves first, followed by gown, then mask and goggles to avoid contaminating clean areas and minimize exposure to pathogens. 111. Which of the following is true regarding the transmission of methicillin-resistant Staphylococcus aureus, MRSA? A. MRSA is transmitted only through direct contact with infected patients. B. MRSA can be transmitted through droplets and requires airborne precautions. C. MRSA is spread primarily through contact with contaminated surfaces. D. MRSA is not contagious. Answer: C. MRSA is spread primarily through contact with contaminated surfaces. Rationale: MRSA is typically transmitted via direct contact or indirect contact with contaminated surfaces, requiring contact precautions in healthcare settings. 112. What is the recommended method for cleaning non-critical equipment that has been in contact with the patient's skin? A. Clean with soap and water. B. Clean with an alcohol-based wipe. C. Clean with a disinfectant approved for non-critical surfaces. D. Do not clean the equipment. Answer: C. Clean with a disinfectant approved for non-critical surfaces. Rationale: non-critical equipment that has come into contact with skin should be cleaned with an appropriate disinfectant that is effective against common pathogens to prevent transmission. 113. What should be done if a patient in a healthcare setting is suspected of having a contagious viral infection? A. Immediately begin antibiotic treatment. B. Place the patient in a private room and use appropriate isolation precautions. C. Wait until test results come back before taking action. D. Send the patient home to prevent exposure to others. Answer: B. Place the patient in a private room and use appropriate isolation precautions. Rationale: until test results confirm the diagnosis, patients with suspected contagious infections should be isolated and appropriate precautions used to prevent transmission to others. 114. What is the most important reason for performing a risk assessment before an outbreak of infection? A. To determine which medications should be administered. B. To identify which patients should be isolated. C. To allocate resources and ensure appropriate infection control measures are in place. D. To determine the potential economic impact of the outbreak. Answer: C. To allocate resources and ensure appropriate infection control measures are in place. Rationale: a risk assessment helps identify areas of concern and allows healthcare facilities to allocate resources effectively and implement the necessary infection control measures. 115. What is the correct procedure for cleaning a blood spill on the floor? A. Wipe with a dry towel and discard. B. Use a disinfectant and wipe away the blood. C. Cover the spill with paper towels and leave it for housekeeping. D. Use a general-purpose cleaner. Answer: B. Use a disinfectant and wipe away the blood. Rationale: blood spills must be cleaned promptly with an EPA-approved disinfectant to reduce the risk of transmitting bloodborne pathogens. 116. Which of the following pathogens requires contact precautions in a healthcare setting? A. Influenza virus. B. Norovirus. C. Tuberculosis. D. Measles virus. Answer: B. Norovirus. Rationale: norovirus is highly contagious and primarily transmitted through direct contact with contaminated surfaces. Contact precautions, including gloves and gowns, are necessary to prevent transmission. 117. What is the recommended practice for cleaning and disinfecting reusable patient care equipment? A. Clean only when visibly soiled. B. Disinfect with a high-level disinfectant after each patient use. C. Disinfect with a low-level disinfectant once per day. D. Clean with water and soap only. Answer: B. Disinfect with a high-level disinfectant after each patient use. Rationale: reusable patient care equipment should be disinfected with a high-level disinfectant after each patient use to prevent transmission of pathogens. 118. How should a healthcare worker handle a patient's soiled linens in a healthcare setting? A. Shake the linens to remove debris. B. Place the linens directly on the floor. C. Place soiled linens in a sealed, leak-proof bag. D. Fold and reuse linens immediately. Answer: C. Place soiled linens in a sealed, leak-proof bag. Rationale: soiled linens should be placed in a sealed, leak-proof bag to prevent contamination of the environment and exposure to infectious agents. 119. What is the appropriate hand hygiene technique after caring for a patient with a wound infection? A. Wash hands with soap and water. B. Use an alcohol-based hand sanitizer. C. Rinse hands under water. D. Apply lotion to prevent drying of hands. Answer: A. Wash hands with soap and water. Rationale: after caring for a patient with a wound infection, hands should be washed with soap and water to remove dirt, debris, and pathogens effectively. Alcohol-based sanitizers may not remove all pathogens. 120. Which of the following is an example of sterilization in infection control? A. Wiping down equipment with an alcohol wipe. B. Using ultraviolet UV light to disinfect surfaces. C. Autoclaving surgical instruments. D. Washing hands with soap and water. Answer: C. Autoclaving surgical instruments. Rationale: sterilization is a process that kills all microorganisms, including spores. Autoclaving is a method used to sterilize surgical instruments by subjecting them to high-pressure steam. 121. What should a healthcare worker do if they accidentally get a needle stick injury? A. Wait to see if symptoms develop. B. Report the incident to the Infection Control Department immediately. C. Remove the needle and continue working. D. Wash the injury site with alcohol. Answer: B. Report the incident to the Infection Control Department immediately. Rationale: needle stick injuries should be reported immediately for proper assessment, post-exposure prophylaxis, and testing for potential infection transmission. 122. Which of the following actions is part of standard precautions in infection control? A. Wearing gloves for all patient interactions. B. Using a mask for all patient interactions. C. Hand hygiene before and after patient contact. D. Placing all patients in isolation. Answer: C. Hand hygiene before and after patient contact. Rationale: standard precautions include hand hygiene before and after patient contact, as well as the use of appropriate personal protective equipment, PPE, based on the situation. 123. What is the recommended isolation precaution for a patient diagnosed with tuberculosis, TB? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Answer: C. Airborne precautions. Rationale: tuberculosis is transmitted through airborne particles, so airborne precautions, including the use of N95 respirators and private room isolation, are required. 124. Which of the following is the primary purpose of using personal protective equipment, PPE, in healthcare settings? A. To provide comfort to healthcare workers. B. To prevent healthcare workers from contracting infections. C. To prevent patients from seeing healthcare workers' identities. D. To meet legal requirements for infection control. Answer: B. To prevent healthcare workers from contracting infections. Rationale: the primary purpose of PPE is to protect healthcare workers from exposure to infectious agents that may be present in patient care environments. 125. Which of the following is considered a high-level disinfectant used for reprocessing medical equipment? A. Alcohol-based sanitizers. B. Hydrogen peroxide. C. Bleach solution. D. Glutaraldehyde. Answer: D. Glutaraldehyde. Rationale: glutaraldehyde is a high-level disinfectant commonly used to disinfect medical equipment that cannot be sterilized. It is effective against most pathogens, but must be used according to manufacturer instructions. 126. What is the most appropriate isolation precaution for a patient with suspected meningitis? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Answer: B. Droplet precautions. Rationale: meningitis is typically transmitted through respiratory droplets, requiring droplet precautions, including the use of a mask and maintaining distance from the patient. 127. What is the correct order of donning personal protective equipment, PPE? A. Gloves, gown, mask, goggles. B. Mask, gown, gloves, goggles. C. Gown, mask, gloves, goggles. D. Gown, gloves, mask, goggles. Answer: D. Gown, gloves, mask, goggles. Rationale: the proper order for donning PPE is to first put on the gown, then gloves, followed by the mask, and lastly goggles or face shield to protect from exposure. 128. Which of the following cleaning methods is effective for non-critical surfaces in a healthcare setting? A. Sterilization with autoclave. B. Low-level disinfection with a household disinfectant. C. High-level disinfection with a medical-grade disinfectant. D. Use of alcohol-based hand sanitizer. Answer: B. Low-level disinfection with a household disinfectant. Rationale: non-critical surfaces can be cleaned with a low-level disinfectant. High-level disinfectants and sterilization are reserved for critical and semi-critical equipment. 129. How often should hand hygiene be performed in a healthcare setting? A. Only when hands are visibly soiled. B. Before and after patient contact and after handling contaminated materials. C. Once per shift. D. Before eating or drinking. Answer: B. Before and after patient contact and after handling contaminated materials. Rationale: hand hygiene should be performed frequently throughout the healthcare shift, especially before and after patient interactions and after contact with potentially contaminated materials. 130. Which of the following statements about the use of alcohol-based hand sanitizers is true? A. Alcohol-based hand sanitizers are effective against all pathogens, including C. difficile. B. Alcohol-based hand sanitizers are less effective than soap and water for removing dirt and debris. C. Alcohol-based hand sanitizers should be used after handling non-contaminated surfaces. D. Alcohol-based hand sanitizers are required when caring for patients in isolation. Answer: B. Alcohol-based hand sanitizers are less effective than soap and water for removing dirt and debris. Rationale: alcohol-based hand sanitizers are effective against many pathogens, but may not remove dirt or physical debris. Soap and water are preferred in such cases. 131. What should healthcare workers do when handling a contaminated sharp object such as a needle? A. Dispose of a needle in an open container. B. Place the needle in a sharps container immediately after use. C. Reuse the needle if the patient's infection status is unknown. D. Throw the needle directly into the trash. Answer: B. Place the needle in a sharps container immediately after use. Rationale: contaminated needles should be disposed of in a designated sharps container immediately to prevent injury and transmission of infectious agents. 132. Which of the following methods is most effective for preventing the spread of infectious diseases in a healthcare setting? A. Using antibiotics for all patients. B. Ensuring appropriate vaccination of healthcare workers. C. Isolating patients in separate rooms at all times. D. Restricting access to the healthcare facility. Answer: B. Ensuring appropriate vaccination of healthcare workers. Rationale: vaccination is an essential method to prevent healthcare-associated infections, HAIs, especially for healthcare workers who are at higher risk of exposure. 133. When should healthcare workers wear gloves according to standard precautions? A. Only when handling blood or bodily fluids. B. Only when caring for patients in isolation. C. For all patient interactions, regardless of the situation. D. When there is a risk of exposure to blood, bodily fluids, or mucous membranes. Answer: D. When there is a risk of exposure to blood, bodily fluids, or mucous membranes. Rationale: gloves should be worn when there is a risk of contact with blood, bodily fluids, mucous membranes, or contaminated materials. 134. Which of the following is an important aspect of outbreak management in a healthcare setting? A. Denying entry to all visitors. B. Informing staff and patients about the outbreak immediately. C. Restricting care to only critical patients. D. Ignoring mild symptoms in healthcare workers. Answer: B. Informing staff and patients about the outbreak immediately. Rationale: immediate communication about an outbreak is essential for implementing control measures and ensuring that staff and patients take appropriate precautions. 135. What is the most important method of preventing the spread of healthcare-associated infections, HAIs? A. Administering antibiotics to all patients. B. Maintaining good hand hygiene practices. C. Isolating all patients. D. Using sterilization for all equipment. Answer: B. Maintaining good hand hygiene practices. Rationale: hand hygiene is the most critical practice in preventing the transmission of pathogens and reducing the incidence of healthcare-associated infections, HAIs. 136. What should be used to disinfect patient care equipment that is visibly soiled with blood? A. Low-level disinfectant. B. High-level disinfectant. C. Soap and water only. D. Alcohol-based hand sanitizer. Answer: B. High-level disinfectant. Rationale: for patient care equipment visibly soiled with blood, a high-level disinfectant is necessary to eliminate pathogens effectively. 137. What is the recommended procedure for cleaning a healthcare worker's hands after contact with a patient in isolation for a communicable disease? A. Wash hands with soap and water only if visibly soiled. B. Use alcohol-based hand sanitizer if hands are not visibly soiled. C. Use hand lotion to prevent drying. D. Do not wash hands if gloves were worn. Answer: B. Use alcohol-based hand sanitizer if hands are not visibly soiled. Rationale: alcohol-based hand sanitizers are effective for hand hygiene unless hands are visibly soiled, in which case soap and water should be used. 138. Which of the following is a feature of airborne precautions? A. Use of gloves and gowns. B. Use of a surgical mask for healthcare workers. C. Use of an N95 respirator. D. Restriction of patient movement outside the room. Answer: C. Use of an N95 respirator. Rationale: airborne precautions require the use of an N95 respirator to protect healthcare workers from inhaling airborne pathogens. 139. When should a healthcare worker perform hand hygiene? A. Only after touching contaminated surfaces. B. Before and after patient contact, and after handling contaminated objects. C. Only after contact with bodily fluids. D. At the end of each shift. Answer: B. Before and after patient contact, and after handling contaminated objects. Rationale: hand hygiene should be performed frequently throughout the shift, particularly before and after patient contact, and after handling contaminated objects or surfaces. 140. What is the purpose of implementing isolation precautions for patients with contagious diseases? A. To minimize the number of healthcare workers involved in care. B. To prevent the spread of infectious agents to others. C. To reduce the time needed for patient care. D. To keep the patient comfortable. Answer: B. To prevent the spread of infectious agents to others. Rationale: isolation precautions are crucial to preventing the spread of infectious diseases to other patients, visitors, and healthcare workers. 141. What is the role of sterilization in infection control? A. To kill all microorganisms, including spores. B. To reduce the number of microorganisms on surfaces. C. To disinfect reusable medical equipment. D. To prevent infections through patient vaccinations. Answer: A. To kill all microorganisms, including spores. Rationale: sterilization is the process that destroys all microorganisms, including bacterial spores, ensuring equipment is free from any infectious agents. 142. Which of the following is true about personal protective equipment, PPE, for droplet precautions? A. Gloves are required only for contact with bodily fluids. B. An N95 respirator is required for all patient interactions. C. A surgical mask is required for all patient interactions. D. Eye protection is not necessary for droplet precautions. Answer: C. A surgical mask is required for all patient interactions. Rationale: droplet precautions require the use of a surgical mask to protect against the transmission of respiratory droplets from the patient. 143. What is the correct procedure for disposing of a soiled dressing from a surgical wound? A. Place the dressing in an open trash can. B. Flush the dressing down the toilet. C. Dispose of the dressing in a sealed, biohazard waste bag. D. Leave the dressing in the patient's room for later disposal. Answer: C. Dispose of the dressing in a sealed, biohazard waste bag. Rationale: soiled dressings should be placed in a sealed biohazard waste bag to prevent contamination and the spread of infectious agents. 144. Which of the following best describes a healthcare-associated infection, HAI? A. An infection contracted from a family member. B. An infection that develops after a patient has been discharged. C. An infection that occurs during or after the patient's stay in a healthcare facility. D. An infection contracted through community exposure. Answer: C. An infection that occurs during or after the patient's stay in a healthcare facility. Rationale: HAIs are infections acquired during a hospital stay or within a healthcare setting that were not present at the time of admission. 145. What is the primary goal of infection control in healthcare settings? A. To eliminate all infectious diseases. B. To prevent the transmission of infections to patients, visitors, and healthcare workers. C. To ensure healthcare workers are vaccinated. D. To reduce the cost of hospital care. Answer: B. To prevent the transmission of infections to patients, visitors, and healthcare workers. Rationale: the primary goal of infection control is to minimize the spread of infections, ensuring the safety of patients and healthcare workers. 146. When should a healthcare worker remove their gloves? A. Before leaving the patient's room, even if still in contact with contaminated surfaces. B. After performing hand hygiene. C. After any patient interaction, but before performing hand hygiene. D. Only after touching the patient's body fluids. Answer: C. After any patient interaction, but before performing hand hygiene. Rationale: gloves should be removed after patient interaction to prevent cross-contamination, and hand hygiene should be performed afterward to ensure thorough cleaning. 147. What is the most appropriate action to take if a healthcare worker is exposed to blood or bodily fluids? A. Report the exposure immediately to the supervisor. B. Continue working and report it later. C. Rinse hands immediately with soap and water and return to work. D. Ask another healthcare worker to document the exposure. Answer: A. Report the exposure immediately to the supervisor. Rationale: immediate reporting of exposure to blood or bodily fluids ensures that proper medical attention and follow-up procedures are initiated promptly. 148. Which of the following is the primary reason for isolating patients with a contagious respiratory illness? A. To prevent the spread of infection to other patients, healthcare workers, and visitors. B. To avoid the spread of disease within the hospital kitchen. C. To reduce patient anxiety during their hospital stay. D. To prevent hospital staff from being overworked. Answer: A. To prevent the spread of infection to other patients, healthcare workers, and visitors. Rationale: isolation precautions are implemented to prevent the transmission of contagious respiratory illnesses, protecting other patients, healthcare workers, and visitors. 149. Which of the following is the most appropriate practice when caring for a patient with a confirmed case of tuberculosis, TB? A. Place the patient in a regular hospital room with no special precautions. B. Administer antibiotics immediately, without isolation. C. Place the patient in a negative pressure room and use an N95 respirator. D. Keep the patient isolated in their room, allowing visitors to enter without precautions. Answer: C. Place the patient in a negative pressure room and use an N95 respirator. Rationale: patients with tuberculosis should be placed in a negative pressure room to prevent the spread of airborne particles. An N95 respirator is required to protect healthcare workers. 150. Which of the following is a critical aspect of preventing infections in a long-term care facility? A. Ensuring visitors have access to all patient rooms. B. Administering antibiotics to all residents on a regular basis. C. Implementing infection control protocols for both staff and residents. D. Allowing residents to roam freely throughout the facility without restrictions. Answer: C. Implementing infection control protocols for both staff and residents. Rationale: infection control protocols are essential in long-term care facilities to protect vulnerable residents and prevent the spread of infections among staff and patients.